Are you ready?
Yes, I am.
Great. Good morning, good afternoon, good evening. Welcome to Coffee Conversations. Today, I'm very excited to be talking to a very good friend and a colleague, Vidamão. He's going to tell us all about himself, what he does, how he does it, and how he's been through this quarantine. Hello, Vidamão, and welcome.
Hi, Larissa. Thank you. How are you?
I'm good, thank you. It's cold. It's starting to get cold, so we're starting to get worried about the flu, but otherwise I'm fine. And yourself? How are you?
I'm doing well. Thank you.
How are things back at the park? I miss you guys.
Yeah, things are going well. Working, preventing COVID-19.
Keeping
Everything is
safe?
okay. Hi?
Great.
Yeah.
I said, are you keeping safe?
Yes, we are safe. We are safe
Good.
and we try to follow all the measures that it's
Mm-hmm.
been putting in place related to COVID-19.
Okay, good.
Yeah.
So I want to tell you guys a little story about Vidamão and I. Back in 2017, we started working actually together on the same day in the park. Two very young professionals starting out, and I remember we hanged out a lot, very much. We learned a lot. We had also a quite young director at the time. Hello, Manuel, if you're watching us. Yeah, Vidamão, do you remember those times?
For sure, for sure. I still remember like yesterday.
Yeah, it's been 4 years. Can you believe it?
Yeah, for sure.
Good. I'm
Yeah.
happy we both here and we can tell the story. What have you been up to all these years? How has the park helped you grow professionally, socially? So I'm very happy to be talking to you today over coffee. Do you have coffee?
Yes, for sure.
Good. So Vidamão, tell us about yourself. Who are you? What was your dream as a child?
Well, Pedro Vidamão, it's my name. Well known by my surname, Vidamão, which means a direct translation. It's life hand. Uh, Most of my colleagues used to call me Life by shorten my surname.
Yeah. So you have
Well,
life by your hands. You save
yeah,
life,
yes. Yeah,
literally.
actually, it's only surname, you know. Uh, when I was a dream, when I was a child, I had a dream to become a pilot.
Oh
Uh,
wow.
so yeah, but from what I remember, when I was on grade 5, my father told me that if you want to become a pilot, you should not have a teeth problem. And on that time, I had some issues related to teeth, so I
I'm
gave up.
getting too many sweets.
Yes, I gave up to become a pilot. And from grade 7, when I went to the hospital to have a consultation or some treatment, I start loving people wearing white at the hospital. And
Yeah.
also, from what I remember, I love biology and issues related to human body. When teacher gave me homework, I used to do more than was requested by the teachers on biology. So from that on, I decided to fed the dream to become a physician, and so that's why now I'm happy with what is my work, you know.
You can still become a pilot. It's never too late.
Oh, no, no, no. Yeah, yes, that's the
So
story.
what's brought you to Gorongosa? Tell us a bit more about your story with Gorongosa. I told a small piece of what was the beginning of your story with Gorongosa, but tell us a bit more. Why did you join? What were you doing before Gorongosa?
Well, after being graduated as a physician, I worked for a national health system in Shibabava district, exactly at Mushungwe Rural Hospital. Shibabava district is it's in the south of Sofala province, and that work I had a huge component of community work. So after that, I have two kind of jobs in a health NGO, but was not a job related to community.
Okay.
And in 2017, I was invited to the park, to visit the park, and also to know about the health project, the expectations. And when I came in, I found many points in common with what I most love, which is to work with the community. So I didn't think twice to accept the proposal, and also in addition to work in this great environment with a huge biodiversity. So that's why I decided to give an opportunity to me to join the park.
Nice. And you also had the experience. You spoke about working in Mushungwe. Mushungwe was somehow a conflict area at the time. So you somehow also have that background in working in conflict areas.
Yes, for sure. Was a great experience, although sad because of the situation itself was a conflict. And but in Mushungwe, I also worked with many issues related to health that we are fighting here also in Gorongosa in a buffer zone. So that's why there is a linkage between these two works.
Oh, okay, good. So Vidamão, you are a doctor, right?
Yes.
So what exactly is your role in the park? So do you, what is a normal day? Do you operate people? Do you take consultations? Do you go to the communities? What is a normal day for you?
Oh, well, I can answer your question, divided it in two parts. The first one is to support the implementation of our health program in the communities in the buffer zone as any health manager. With my colleagues, we have many components here in the health program, which is done mainly in the community. The second part of my role here is as a physician, as a park physician, because we have clinics here inside the park, and I do some consultations, and also I advise for a specialized consultation that can be done out of the park. So these are the two sides of my role here in the Gorongosa National Park.
So what was your day-to-day like? What did you do today?
Well, I went to the office. I was doing a report, and I also had two consultations on the rangers, and was basically these kind of things that I usually do. These days we are going. We are not going too many times in the field because of the situation of COVID-19. So we are reducing the going and back to the community. So our daily works.
Yeah, that's what I wanted to ask. How's the pandemic affected the work you do? How has it affected you also personally?
Well, actually, myself and also my colleagues, we are in a bit of pressure during this pandemic because, as you know, we have the role to put everyone here inside the park in safe, and also to implement some measure to reducing the risks of contamination of COVID-19 for the workers inside the park. But also we need to contribute to transmit the same safety to the community surround the park in the buffer zone. So we need to be ready 24 by 24 hours to respond to the situation, to the pandemic, because it's the time that is requested on us more than we normally do.
Exactly.
Yeah.
And we've been getting a lot of help from everyone, and I would like to take this opportunity to say thank you to everyone who has sent us things, who have helped us with the monetary funds. We just heard that we're gonna get 200 face masks from Boise, so we're very thankful for everyone who's contributing to help us help ourselves and the communities as well. Vidamão, what do you think of the pandemic? You as a doctor, how do you see the pandemic? What do you think Mozambique should do, or is it doing the right thing in terms of precautions?
Well, I think there is no doubt that the pandemic, the situation is there. We need to respond positively to the situation. We need to follow all the instructions, all the preventive measures that it's being broadcasted daily by the recognized institution. I'm talking about World Health Organization, National Health, Ministry of Health of Mozambique. So we need to follow all of these measures to reduce or to cutting the transmission of the disease. And in my opinion, I think the government is doing all the best that they can do based on their institutional capacity. But we as individuals, we should do more. We can do more than what we are doing. Yeah, to be safety, to stay home, to implement the social distance.
Yeah.
To use facial mask when we go out, washing our hands frequently and correctly, and to look for our neighbors, our colleagues, if they are implementing also the measures, because we can't only focus on us, but also on people that are surrounding us, because all of these.
We should be calling out to people who are not taking the precautions, because we have to remember, if they get it, it's most probable that we get it. So it's taking care of ourselves and everyone else. So it's a really critical time for everyone in the world. And we've seen that many places overseas are now stopping some restrictions, starting to opening schools. What do you think? Do you think that's a good idea, or it's still critical times?
For us, is in Mozambique, or
no? I mean in general, in the world, because some schools are already opening, and
I think it's depending on the situation, the level of the pandemic that each country is. And also in evaluation, the risks that they have on getting the disease. Each country, it's in a different phase of the pandemic. So the measures have been implementing or relaxing depending on these. So
that's true, and it's very tricky. I wouldn't want to be a politician right now. I think it's one of the hardest times to be a politician. So good luck for everyone who's in the front line. Before we continue, I wanted to welcome everyone who's just gotten in. Thank you for tuning in. We are today talking to Vidamão. a doctor working under the human development in the park. And he's telling us a bit about himself, how they are handling the pandemic, and also how COVID is affecting Mozambique and what we should be doing. So Vidamão, tell us about human development in general. What is it? The park has so many parts. So the Gorongosa project has the conservation part and then the human development. Tell us in general what is human development about?
Well, in my opinion, human development is a giant department in the park, and it's a face of the park to the community. So where we can find many programs, all directed to the communities, from community relations, education, health, WASH. So,
yeah.
For instance, in community relation, it's the program that deals with the linkage or the connection between the park and the community and vice versa. So bringing into the park all of the priorities that the community have to feed our plants into the park to implement there in the same community. It's also a role of community relation to continuously improve this relation between these two sides of the coin, which is the park and also the community. And we expect to work together in the same way.
Yeah.
Community relation also support the communities to do a sustainable management of their natural resources. So it is important to the park, but also to the community.
Of course.
Yeah. In the same human development, we can find also education, a huge education, because our education is divided in three. We can see girls' education program.
Girls clubs. Woo-hoo.
Yes. Yeah. Girls run the world. So girls' education program that aims to keep girls in school and also to avoid for them to encourage them to complete their studies and by
delay
this
the marriage.
Delay the marriage, and also by this we can support these avoiding of marriage, and also in the same education we have also a program that is a youth club, because in the girls' education we deal with children from 10 to 16 years of age, and in a primary school. But thinking of secondary school, we have this youth club that aims to continue supporting the girls and boys at the secondary school, but thinking about the employability of the girls and also the school. All of this we can find in the education
sector.
But we have also conservation education that aims to a greater understanding of learning process about conservation.
In general.
By doing so, people doing mobile cinema, planting trees, nursery, eco clubs, and all of these we can find in these huge education program. But also in the same human development department, we can find the WASH program that stands for water, sanitation, and hygiene.
Which has become very vital at the moment during the pandemic, right?
Yes, with a vital importance for people because we use water and soap to clean our hands and to prevent one of the big measures to preventing COVID-19 is to wash hands frequently and regularly. And so WASH intervention aims to increase the access of drinkable water in the community through rehabilitation and construction of some boreholes. And after this rehabilitation or construction of boreholes, the WASH program create water and sanitation committees for sustainability of the boreholes.
Yeah, to ensure that the community also has and takes ownership because it's their borehole.
Yes, for sure. And finally, in the HDD department or Human Development Department, we have the health program that aims to improve the living conditions of the community in the buffer zone through components such as mobile brigades, community health workers. We work with APEs, which stand for Agent Polyvalent Elementar, and also traditional birth attendant or midwife that's supporting the implementation of maternal and child health. We also work with another community health workers called model moms to support the nutrition. So by all of these components of health, we support the district health service implementing what is expected for the communities related to health in the buffer zone. So this is the summary of what the human development does in the buffer zone community.
So basically, the human development is the department that deals with the people in the park, correct?
Yes, yes.
And you are trying to ensure that they have good health or health services provided for them, education, as well as livelihood, and help them with any technical training and alternative livelihoods.
Yes, because for the park, it's not so important to preserve the biodiversity, but also to increase and improve the living condition of the community surrounding the park in a way that has a community and also the workers, the people working in the park, all of these two parts contribute to preserve the biodiversity.
Exactly.
Yeah.
True. They should always go together. And Nelson Mandela said it well long ago that conservation is putting people also on the front line of conservation. Vidamão, we have some questions from the audience, some people who have tuned in. And we have two questions for you. We have one from Kelly, which says, what is your favorite part about your job and what is the hardest part?
Well, the favorite part is when I daily manage to solve one health problem or I contribute to solve one problem. And the hardest part is when we have a fatality, because as a physician, we do our best, but sometimes we can't do enough, or we can do all of things to save lives. So these times is the hardest part of my job, when we have a fatality, when we can't solve the problem that of our patients or colleagues or someone from the community.
Yeah, it must be very hard, even though you tried your best. And unfortunately, this is also part of life.
Yeah.
Let's continue with the questions. We have another one from Nate. Thank you for the compliments. You can get these shirts, pullovers from our Gorongosa Coffee website.
Thank you. Thank you.
Okay. Getting to the question, Nate says, Pedro, can you speak about the challenges of educating communities in the buffer zone on the threat of COVID-19?
Well, as you know, this COVID-19 is something new for us and also for the community. And one of the priority for us was to raise awareness on that, because if they know what is COVID-19, how someone can get the disease,
Yeah.
it's easy for them to prevent. But also, people are used to get together and to tell them that you should have a distance of 1.5 meters, also 2 meters. You should wear mask every
It's
time that you
very
go out.
hard.
Yeah, it's very difficult for them to understand because they were not used to do this.
Yeah.
So it's hard here, and it's hard also everywhere. So to ensure that people understand the message, and we are now using different ways, sport radio and pamphlet, official pamphlet, and using community health workers that lives in the buffer zone to speak with people. So we are doing all techniques that we have to make it easy for them to understand. So it's not a easy job.
And do you remember how many people we have trained? I remember the WASH team was training people to go and train or pass the information in the communities.
Yeah, now we are using the 88 APS that are spreading in the buffer zone because as we need to reduce the movement of people. Yeah, and we are using these APS that they live in the buffer zone, so it's easy in the radio that they working in a daily basis to spread information. So we send the pamphlet with information. We talking with them in a daily basis, and we are getting information of what is being done. But we are using radio spot that can reach more people easily.
Yeah.
So yeah.
And have you seen any changes? Are people wearing masks, for example, in the community when you are able to actually go there? Are they getting together less? Or what do you reckon? What's going on? Are they changing? Are they concerned?
Yeah, in the beginning it was a bit difficult, but now we can see in the town when we go and also in the communities, all the people in the market wearing masks and trying to avoid these getting together, but still have one or two people with limitation of wearing masks. And some of them say that they don't have money to buy masks. So we also started producing masks and sending to these APS for them to offer in their community. To have many people without excuses of implementing the measures.
Yeah. That way, if they say I don't have money to buy a mask, you give them a mask. Now they can't say I can't wear a mask. That's
sure.
very good.
Yeah.
That's very good. We don't have any more questions, Vidama. I wanted to ask if you have any last considerations, any suggestions, anything you would like to say to our audience tuning in.
Well, what I would like to say is people should stay home to stay safe. And for those who need to go out, so should follow all the measures that is being broadcasted, recommended by the recognized institutions. So avoid touching things, take care with your hands, wash hands correctly and frequently, wearing mask when you go out. So minimize the risk of getting the COVID-19 and try to contribute positively to this situation that we are living.
True. Try and turn it into something positive.
Yes.
Great. Thank you very much, Vidamão, for accepting our invitation. Please send a big hug to everyone there with you. I know you guys are working very hard. I'm working from home, so I'm trying to do my best to follow the measures as well. And so I just wish you guys good luck. And we are here also to help as much as we can.
Well, thank you, Larissa. It was a pleasure to talk with you. And we're still together.
Yeah. Before we end, I would like to announce today's winner. Congratulations to Nate. Well done. Our team is going to get in touch with you to give you your Gorongosa trio. Thank you very much, everyone who tuned in, everyone who learned today about Vidamão, who learned about COVID as well. See you next week, same time, same place. And next week we have a surprise. So invite everyone to stay tuned and stay well, stay safe, in very good taste. Bye.
Bye.